Leaders of persons living with disabilities in Kakamega County have joined hands with religious leaders from various faiths to sensitize the public on the importance of vaccinating children as a way of preventing diseases linked to lack of immunization. Speaking during the event, the Chief Officer of Risk Management and Service Delivery, Dr. Vitalis urged religious leaders and other stakeholders to take an active role in spreading awareness about vaccination, noting that it is one of the simplest ways to prevent avoidable illnesses.
This morning we have a meeting here with religious leaders, all the stakeholders. We have bishops here, we have sheikhs, we have major stakeholders. We have Nawongo here, the Wanga Kingdom and other people, to make sure that they go out there and create strategic awareness. So now people are aware that if you don't if you don't exercise extra care and ensure that your children are immunized, they can easily get into trouble, get disabilities that you would have easily avoided if the necessary precautions and safety measures were taken.
Dr. Were commended Kakamega Governor Fernandez Barasa for putting in place strategic measures that make it easier for persons living with disability to access services and resources they require. He also praised President William Ruto for assenting to the 2025 Persons with Disability Act, describing it as one of the most transformative pieces of legislation with full of benefits for people living with disabilities.
I'm happy that Kakamega County, our governor has done so much. We have a Disability Act, our county's Disability Act. We have a Disability Committee in place. The governor has pointed to that one. We have governor giving grants to groups of disabled people. We have governor, he has ordered that all county plans, approvals plans for construction of facility infrastructure must be disability compliant. I'm also happy that His Excellency the governor, His Excellency has done a lot of work around infrastructure. If you go to his office, you see there's a lift there. But I also want to thank the president of this country, His Excellency President Ruto, that by assenting to the Persons with Disabilities Act 2025, a very robust piece of legislation. I think it's going to be the best legislation in Africa in terms of disability rights and that which is going to even give now benefits to caregivers of children with disabilities and disabled people. If you remember the last act, the one we had with 2003, it did not have provisions to support for. So, for example, today, if you're a mother of a disabled child, you can get some relief and support, which was not there before. Today, the private sector and everybody else is now enjoined by that law to make sure that if they're talking about infrastructure, the infrastructure is compliant with disabilities. So, as people with disabilities in this country, we want to thank the president of this country that piece of legislation is extremely transformative, and we are really happy about it.
At the same time, Dr. Were reassured residents that vaccines available in Kakamega County were safe and secure, urging the public not to fall for propaganda and misinformation that undermines vaccination efforts. He further called on the county government departments, religious leaders, and the community at large to come in togetherness in promoting child vaccination in order to safeguard the health and the future of the next generation.
There are still myths about people think, others say these things are not safe, others think, these things are just government propaganda. That's not true. I want to tell you that His Excellency the governor of this county cannot in any way gamble with the lives of our children. He cannot do that. And if the vaccines we're talking about are safe, they're secure, and I want to ask people to this normal porojo ya siasa ya pesa nane dogo hiyo, it has no place. This is about people's lives and people's future, and therefore we must guarantee that. So governor cannot do that. I don't even think the president of this country can do that. So people who are trying to politicize this kind of campaign and bring in myths and myths and we want to demystify those things, that this is a serious campaign for the future of our children, safety of our children, and nobody should be able to bring in what we call the extraneous issues. The county has what is called community areas administrators, CEAs. We have ward administrators, and we have sub-county administrators. We want this message to go to them. Let them, when they do those barasas and the chiefs and everybody else, the GAO officers, the national government administrative officers, plus our county administrative officers, to work in tandem, to work together, so that this message can clearly and unambiguously reach the population that immunization and treatment, reaching out to health facilities is extremely important.
Timothy Sonic, Shahidi TV, Kakamega County.